Hi, everyone. This is Alex. If you don't know me, I'm a nurse practitioner. I practice functional medicine with Dr. Young here in Florida. And today I want to talk to you about vitamin D. This is such an important subject because we practice in functional medicine and we see a lot of people coming to us due to chronic disease, hypertension, diabetes, fatigue, chronic fatigue. People have all kinds of joint pain and memory loss and brain fog. And one of the very simple things that we have noticed, and I have noticed for certain in the practice, is most people either they have not had their vitamin D levels checked in their blood, or if they did have it checked and they were told that they have low vitamin D levels, they're not really doing anything about it. Or if they are doing something about it, they're probably not doing the right things. So I just want to go over that with you guys today because it's such an important subject. As you can see in my picture, I have the sun coming up there, the sunrise. So vitamin D comes mainly from the sun exposure, and it's so important. It's one of the forms of life. It's one of the forms of energy. That's how our body uses vitamin D to make energy and to get your mitochondria to function. So I am going to be talking about that, but in order for me to do that, I'm going to utilize the latest scientific research paper that I have seen in the past few weeks. So today is July 30th. This paper was published July 15th, 2020. And it talks about the immunological effects of vitamin D on the human body, and the human health and disease. And if you notice here, the name, one of the authors here is Dr. Michael Holick. Dr. Holick is the authority as far as the research done in the U.S. As far as vitamin D. He is responsible for the guidelines. He sits on the guidelines that dictates what your blood levels should be. When you look at your results at your blood and you see that the levels go from 30 to 100, that's based on Dr. Holick's research. He wrote a book about the vitamin D solution, which is a great book. You go ahead, you can get that on Amazon. But he has years and years of research about vitamin D. And thanks to him, we have more of an understanding that vitamin D is a hormone, and it functions not just for your bone density and but also for your immune system. It's so important as it relates to your immune system. So this paper is not only just a recent publication, but it's a publication that what we call the review of the literature. So what they did, they took all the relevant information of all important publications in the medical community. They put it all together and they wrote a review paper. So they're just going over the findings. So it's a 28-page paper. It has over 100 references. This paper is 199 references in this paper. So I think it's such an important topic right now as we're going through this COVID-19 to understand really down to the nitty-gritty what vitamin D does for you. One of the things that we need to understand is that vitamin D is one of the forms, you can get it through food or, through supplements. When they add vitamin D to milk, you can get it through eggs, cod liver oil, through fish. But one of the main ways that you truly get vitamin D is through sun exposure, percentage of sun exposure. So technically, you would have to have full body exposure to make enough vitamin D for survival. So that's a problem because a lot of us are indoors most of the time. So we really don't have enough sun exposure. So we're going to go over supplementation also. But it's a hormone. Like I said, Dr. Holick did so much research on this, and we still talk about vitamin D as a vitamin, as you have to take it. So you don't necessarily have to take it as long as you're exposed to the sunshine. your body should be able to make enough vitamin D. Now, this is not new information. We've known this for a while. That's why I put this study on my presentation here. This author talks about from vitamin D to hormone D, because he goes on to explain that it's should be considered a steroid hormone and not a vitamin, because you necessarily don't have to take that orally. In this paper, as you can see here, it was published in August 2008, which means that we've known this for a while now. And it just blows my mind how I still have patients coming in the office with super low vitamin D levels. I just don't understand. It's been out there. It's in the medical community. It's common knowledge into the scientific community. So I'm just going to show you, this is also part of the Dr. Hollick's paper as it regards to vitamin D deficiency. So what causes vitamin D deficiency? Why are you low in vitamin D? Of course, like I said, if you're not out in the sun enough and you don't have full body exposure, you're going to have low levels of vitamin D. But also, if you use sunscreen, if you are how they say here, high altitudes, and it's the winter time, the color of your skin also affects how you're going to convert vitamin D in the skin. Medications for seizures, medications, steroids that use for inflammation, antibiotics, St. John's wort, some people know what that is. That's an herb they take for depression. That also lowers your vitamin D. If you have a liver failure, kidney failure, if you have obesity, if you have any problems with your gut, malabsorption, celiac disease, Crohn's disease, all of those problems in the gut, if you had bariatric surgery, you're going to have low vitamin D levels, even if you take it orally. So it's important to know the cause. Why do you have low vitamin D, so we can address the cause? But interesting, there's a lot of illnesses that have been associated to low vitamin D levels, neuropsychiatric disorders, depression, respiratory infections, as they even listed here, COVID-19, because there's a huge research going on about low vitamin D levels and people that end up in a hospital with serious consequences of COVID-19. Hypertension, tuberculosis, type 2 diabetes is associated with low vitamin D levels. Muscle pain, of course, we all know low vitamin D can lead to osteoporosis, osteopenia, skin problems, psoriasis, certain types of cancer. It's so important for breast, to prevent breast cancer. You gotta check your vitamin D levels and make sure it's optimal. Psoriasis, there's a lot of research talking about associating low levels of vitamin D and psoriasis and a lot of skin conditions. Asthma, allergies, because it's such an important hormone for your immune system. So there's all of these illnesses that have been associated with vitamin deficiency, which means if your blood levels of vitamin D3 are below 30, you have vitamin D deficiency. So then the paper goes on to talk about several things about the immune system, about the respiratory system, but I'm just going to highlight the most important things that I think that make it easier for people to understand why this is so important. This picture right here, as you can see, those are cells. Those are your immune cells. So they give you two different cells here, main cells, macrophage, the monocyte, and dendritic cells. Those are the first line of response as far as your immune system. If your immune system is hit with a bacterial infection, with a viral infection, these cells, they go into the defense mode, and it will signal other cells, the B cells, the T cells, the T regulatory cells, to tell them what to do. Hey, we have an invader, let's do something about it. But in order for them to function, as you can see here, so vitamin D has to go inside of your cell and be converted through an enzyme into 1,2 25-dehydroxy vitamin D. Once that happens, then the cell is activated and it can produce all of these anti-inflammatory compounds and also interleukins, which is just signaling molecules to tell the other parts of the immune system, other parts of your body to start functioning, defending you. One of the interesting compounds that's produced by the macrophage is catalidocin, which is an antiviral substance. It's found that when the virus is exposed to that substance, it breaks apart. It destroys the virus. So that's why vitamin D it's been talked about it so much in regards to COVID-19. So it's very helpful to not just to regulate all the other immune cells, but also there's specific substances that are related to antiviral and antibacterial properties. One of the things that I think you guys need to understand, the vitamin D, once it gets to your body, it's not just one simple hormone. It has several different types of metabolites. That's why in this paper, you can see there's 25-hydroxy-D and 1,25-dehydroxy-D. So those two different types of vitamin D, they are important to have in your body, and they have different functions. So the chemistry can be a little bit complicated, so I'm just going to try to make it very simple. But this picture, this is just so you realize how many things go on because you have vitamin D in your body. One important thing for me, because we do see a lot of patients with autoimmune disease in our practice, Hashimoto's thyroiditis, celiac disease, lupus, psoriasis. We have so many people with autoimmune problems. The T regulatory cells are so important to the autoimmune disease. As you can see, if you have enough vitamin D, your T reg cells go up, which means they're good. If you go up, then you can regulate your immune system. So if you have an autoimmune disease, it's also important to check your vitamin D levels. So the vitamin D, as it shows in this slide, is a antiviral, antibacterial, and modulator of your immune system. Just to simplify, that's how it works. But nature is so perfect. You see how the arrows go down and up. Different interleukins means different things. Tumor necrosis factor, they signal different things in the body. So it's super important to have this hormone in your system. So I just picked, like I said, some of the things that I thought was super important in this paper. And one of the topics is endothelial function and vascular permeability. Basically, what that's saying, it's saying that vitamin D is also very helpful when it comes to hypertension, cardiovascular disease. What the authors are explaining is that in order to have the substance that regulates your blood pressure, nitric oxide right here, in order to have this, you have to activate an enzyme that calls ENOS, endothelial nitric oxide synthase, in order to have nitric oxide. But you can only activate this enzyme if you have vitamin D in the system. So it's fascinating how one thing is connected to the other. So basically, the vitamin D goes in your system, activates your VDR receptors in the tissue of your endothelial cells, meaning the tissues of your vascular system goes in there, activate the VDR receptors, and increase the function, increases the activity of this enzyme. Therefore, you have all these pathways here, as you can see, and then you have the production, more production of nitric oxide. So basically, at the end, as a conclusion here, they say that taken together, meaning because there's two mechanisms of action of how vitamin D works in that vascular system. If taken together, it is evident that vitamin D and its metabolites exert a plethoric effect on the endothelial and the positive and is protective against vascular dysfunction and tissue injury as a result of local and systemic inflammation. So inflammation is the word. We keep saying to patients with cardiovascular disease that we really got to get the inflammation down. And how do we do that? Let's change the diet. Let's start to exercise. Let's do all these things. But now see how they're describing here, how this hormone that you get from sun exposure, how that influences your inflammatory response, how that lowers and downregulates your inflammation. It's so important. So they go on and talk about different conditions. But one of the problems and one of the arguments that we already that we have a lot in the medical community is vitamin D is kind of tricky. It's hard to supplement because it can cause toxicity if you take too much. It's a fat-soluble vitamin. You can have kidney problems and you're going to have kidney stones. You got to be careful. If you're going to supplement that orally, you have to take very little. So we really don't have a lot of randomized controlled trials accounting for all the difference to say how much should we take for sure, because there are genetic differences. But what we do have is some case studies. And this paper is interesting because they do present 2 case studies. And one of the case studies I'm going to tell you guys is a patient with MS, a 50-year-old female patient with MS, and she was given 40,000 units of vitamin D a day. Now, keep in mind that most of the guidelines say do not take more than 2,000 units a day orally. So she was taking 40,000 units daily, and she was given that dose for 5 years. So what they noticed was, so they told her, you're going to take this amount of vitamin D for the next 5 years, and you're not going to do a lot of calcium. You cannot take calcium with that high dose. But they noticed that at the 12-month mark, her calcium levels were elevated in the blood. And that's a no-no. It's a no-no because doctors don't like that. Elevated calcium levels means vitamin D toxicity. That means you're taking calcium from your bones. We need to lower your vitamin D levels. That's dangerous, and it can mess up your parathyroid gland. So they went back and talked to her, and sure enough, she was eating things that had too much calcium. So they changed that. They said, okay, let's cut these vegetables. They have too much calcium. Let's just not eat them. And they kept giving her 40,000 units a day, and they kept maintaining her blood levels at 250 nanograms per ml. Remember, in the US, we go, the numbers, the range goes from 30 to 80 nanograms per ml. So they kept her at 250 for 5 years. So what they noticed was once they corrected the calcium intake, her blood calcium levels went back to normal. And she says, she reported back that her symptoms, she had improvement, neurological improvement. Her symptoms did improve. And she did not have any kidney stones, not calcium in the urine, and not calcifications in the urine either. So this is a case study. Of course, everyone will respond differently, and you have to do that with the help of your doctor. But in this slide, I'm showing you the data that they collected from this lady. So as you can see, they kept her vitamin D levels at 240. And at the 12-month mark, her calcium levels, as shown here, was above 10 point something, which is, we don't like to see that. So that's where they did the change. They said, well, don't have so much intake of calcium or vegetables with calcium. So they cut down the intake of calcium. The calcium levels went down, and they kept the vitamin D levels pretty high for the whole time. As you can see, even though they did that, the calcium levels went down, and her parathyroid hormone levels never really changed. So therefore, she had no vitamin D toxicity as per guidelines. So she had no toxicity. She was fine, and she had improvement. And there was another case where they did the same thing with a patient, was a younger patient, and they show the same results. So we have 2 case studies here. But the situation is always very controversial because your doctor has to be working with you and understanding your diet and testing your blood work in order to figure out how much vitamin D you should supplement if you're going to supplement orally. Okay. Another point that I think is so important right now is vitamin D as it regards to respiratory viral infections. So they're talking about specifically about SARS here. So there were some studies done in the past where they say there was a significant reduction in hospitalization from acute respiratory infections when you have when you don't have vitamin D deficiency. If you have vitamin D deficiency, it's the higher incidence of acute respiratory infection with hospitalization. So what they're saying is that basically the vitamin D has an antiviral activity and also modulate your immune system. So regulates, like I said before, a lot of antiviral substance in the body, modulates the tool-like receptor cells, natural killer cells. So it tells your immune system to go ahead, fight this infection, as well as suppressing overexpression of pro-inflammatory cytokines. Now, this is super important because as we've been talking about COVID-19, the problem is when people get very ill, they have this, what we call cytokine storm. So they have this release of all these pro-inflammatory cytokines, and that's when they need to be in the hospital and get treated, and we have a hard time treating these patients. So it looks like the vitamin D suppresses the overexpression of pro-inflammatory cytokines. So that's pretty important. So you can conclude with that if you take oral vitamin D, or if you have normal levels or optimal levels of vitamin D in your blood, you're likely not to end up in a horrible situation in a hospital. So they even go ahead and say that a recent meta-analysis of 25 randomized controlled trials. That means that's the highest as far as research goes, that's the gold standard. 25 randomized controlled trials showed that supplementation with D2 or D3 can protect against the development of acute respiratory tract infection compared to placebo, compared to nothing. So there's a lot of evidence out there that vitamin D helps with the respiratory infections. The other part that I did highlight it here is that they look at vitamin D as it regulates the ACE2 receptor. ACE2 receptors are these receptors in the cells where the COVID-19 virus binds to it and then enters the cell and is able to replicate in the cell and cause an infection. So what the authors are saying is that vitamin D down-regulates the receptor, so you don't have enough of these ACE2 receptors. Therefore, the virus doesn't have a place to bind and to multiply. So that's their conclusion. So therefore, they're saying it is proposed that supplementation with vitamin D reduce the risk and the severity of the COVID-19 infection. So you might still get it and maybe still get sick, but not as sick as need hospitalization or a ventilator, which is, I think it's a very interesting point. And of course, like I said, always ask your doctor and check with your doctor your vitamin D levels, because there's the whole calcium situation that can happen there. This part of their paper I found super interesting, and I just want to show this to you guys. Why is it that some people, when they have optimal levels of vitamin D, they either feel better or they have less respiratory infections, and others not so much? So what they're showing here is your genes. Basically, they have a few patients. If you look, there's a 34-year-old patient here, 46, 56-year-old, a 66, a 68-year-old, a 73-year-old. What they did was they supplement these people with 10,000 units of vitamin D a day, daily. And what they did, they test the vitamin D levels at baseline and then at 6 months. At baseline, I'll give you an example. This patient here, 68-year-old person at baseline, the levels of vitamin D were 23. After 6 months of 10,000, it got up to 96 in the blood. So what happened with that is, as you can see on the bottom with the 23 here, all these genes were, like you see how it's blue and red. And when you look at with the supplementation with the 10,000 units a day, there's a upregulation of most of the genetic profile on this patient here. This patient, on the other hand, even though we went from 18 to 88 in the blood, the vitamin D didn't really change his or her genetic profile very much, maybe here a little bit. And it didn't really downregulate many genes, but it did a lot for this one patient here. So what they conclude from this was that 60% of the patients that they gave the 10,000 units of vitamin D, they noticed a genetic difference, a genetic upregulation and downregulation of certain genes. And 40% of those people did not notice anything. They did not notice any change in their genetic profile. Now, what they're explaining is that they don't really know why that happens, but there's a possibility that has more to do with genetic mutations. Some people have a VDR mutation. Some people have a double mutation on that VDR receptor, which is the receptor for the vitamin D in the cell, in the nucleus of the cell. So that could have been one of the reasons why for some people they don't see a genetic, an epigenetic change or a genetic change. There are also, of course, enzymes responsible for converting the metabolites of vitamin D. That could be one of the reasons why. And this is interesting because this is one of the possible reasons why when we do a randomized controlled trial and we follow these people for many years, at the end of the study, they don't see any difference, or they see a slight difference, but it's not significant. It's probably, it could be, as they speculate in the paper, because we're not accounting for genetic differences. So some people respond in a certain way and other people's not so much. So as we keep studying this, we're going to notice differences. So I just think this is unbelievable, fascinating. So if you're going to supplement with vitamin D, how much should you take? Per guidelines, as you can see here, per guidelines, if you are at risk to have low vitamin D or B vitamin D deficiency, like I said, one, you got to get tested. But for individuals 18 years or older, they say the upper limit is 10,000 units a day. As a daily requirement, up to 2,000 units. If you are obese or if you have problems with your digestion and you have malabsorption, then you see the daily recommendation, changes, goes from 4,000 to 6,000 units a day. And the upper limit is still 10,000 units daily. I say, you gotta test. Every patient is different. Sometimes you don't know if you have malabsorption. Sometimes you don't know. So that's why you have to get tested. But the idea here is to get your levels above 30. See, this is the idea. There's some research papers that talk about the vitamin D, 25 hydroxy vitamin D blood levels should be around 70 for females because of the breast tissue depends on, and again, the hormone vitamin D. It's so important for detoxification and to prevent nodules and calcification in the breast tissue. So a lot of times I try to maintain for my female patients a level, higher than 30 for sure. So, of course, this is oral supplementation. So, you have control of how much vitamin D you're taking. But if you want to so I have heard from patients that they just want to go out in the sun. They just want to go out there, get exposed to the sunlight and get vitamin D that way. What I say about that is, one, you have to, it's a problem for the dermatologist because they're going to tell you otherwise. Do not go out in the sun. Do not get sun exposure. Put sunscreen. And the other issue is you just can't go all at once and get all the sun exposure at one time. That's not the way to do it. You have to go slowly, maybe first thing in the morning, 10 to 20 minutes until you develop tolerance and you don't get sunburn. You don't want to get sunburn. And the other problem is that, the aging process of the sun, some, especially women, we don't like that. So it can be a little tricky and controversial, as far as your doctors, they don't like you to do that. So, I just say also, if you're in the wintertime, you might think you're getting some vitamin D if you're out in the sun. And sometimes you're not at all. You're not at all. And like I said, there's a genetic variations. So you really need to get tested in order to know for sure. But I will tell you this, as far as skin cancer, the melanoma situation where all your doctors will be telling you not to go out in the sun because it's super dangerous. You're going to get melanoma. This paper here that I'm showing you, it was published, I want to say, 2016. I think it was published in 2018. But it talks about melanoma, and they analyzed the worldwide as it relates to sex, age, and skin type. So what they found was, when you look at this, you're going to find that this is super interesting. They found that what causes melanoma likely, it's not the UVB exposure, because they noticed that Americans in some age groups have significant increasing melanoma incidence with decreasing UVB exposure. So at certain age groups, Americans have been using the sunblock protection, not going out in the sun, but there's high incidence of melanoma, skin cancer. So they're not exposed to UVB light. So what they're saying is it's possible that there is a role for vitamin D3 through the skin, meaning you're not getting the vitamin D in the skin. Therefore, your incidence of cancer goes up. Remember, we just showed you all the immune responses and the immune responsibility that the vitamin D has in your body. So if you have low vitamin D levels, they're saying there's a possibility that's what's causing the cancer. And UVA radiation. By UVA radiation, because people are more exposed to indoor lighting through the windows and outdoors with certain sunscreen formulation. Basically, they're blaming the melanoma on exposure to UVA light, artificial light, from being too much indoors, or when you use the sunscreen that does not have UVA protection. Now you have more UVA exposure, and that seemed to be more to blame as far as melanoma and not so much sunburn. So, so there's that as far as melanoma goes. So if you're indoors, I try to tell my patients, maybe you need to use a UVA sunscreen if you're indoors, because of this situation now. So guys, I hope this was helpful, and make sure you get your vitamin D tested, and we'll talk next time. Bye-bye.